Hello, you are listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at my two websites, catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletters so you can learn even more about how you can heal yourself naturally. Now, our guest today is Anita Chakraburtty. Anita Chakraburtty is a naturopath, a professional astrologer, and a shamanic healer. You can find out more about Anita Chakraburtty and her wonderful work at her website, multidimensionalhealing.co.uk. And for our UK audience, she is based in London. Welcome, Anita Chakraburtty.
Thanks for having me on your show, Catherine.
So we're going to be talking about a really important topic today, which is the top 10 herbs for men's health. And of course, there's a lot of women who are super interested in natural healing, and sometimes the men get overlooked, but they want to be healthy too. So let's start with herbs for andropause. So first of all, Anita Chakraburtty, what is andropause, and what are some of the symptoms that a man might experience that might indicate to him that he's going through andropause?
So andropause is similar to the female menopause. And, you know, we are blessed as women. Menopause now is being openly talked about. There are lots of forums, lots of TV shows, lots of books, but male andropause is not discussed as much. And hopefully, you know, us talking about it is going to get it more out there. Men, you know, becoming more comfortable discussing it. But it's basically a decline in testosterone. And in men, testosterone does decline after the age of 25. But once you get to 50, that's when you are more likely to see a more dramatic reduction in testosterone. And, you know, there are medical conditions and comorbidities that men get when they're older that can also lead to a more dramatic reduction in testosterone. For example, insulin resistance, and diabetes, that can cause some issues with testosterone. Adrenal stress. So when you have adrenal stress, obviously that affects cortisol, and cortisol can impact on testosterone levels. So stress is a factor in male andropause. But if you had to talk about like the medical common day physical symptoms that a man would have that might make him think, I might have male andropause, there's a cluster of symptoms, okay? Muscle shrinkage, muscle atrophy, osteoporosis. Sorry, but I shouldn't really use jargon, should I? Atrophy means shrinkage, yeah. Osteoporosis. So again, we're very blessed as women that osteoporosis gets spoken about quite a lot from a female perspective, but men, you know, with this drop in testosterone, they are also more predisposed to get osteoporosis, which is basically a leaching of calcium from the bones that make the bones more brittle, more fragile. So if you fall, rather than going, oh, I've got a bit of a bruise, you're like, oh, I've broken my arm, I've broken my hip. Okay. Reduced sexual function, which is common in, you know, andropause, and increased fat mass. So that kind of middle-age spread that men get, similar to what women get when we have our menopause. So men get that as well. But that kind of visceral adiposity around the belly in men causes lots of inflammation and, you know, and other health issues. But another thing about andropause is not all men get affected by this drop. Yeah. So in the same way that not all women have a bad menopause, only kind of, you know, 40 to 65% of men get affected by male andropause symptoms.
Great information. So Anita Chakraburtty, you're a naturopath. What are the top 2 herbs for male andropause?
So one common condition that happens with the drop in testosterone in men and men over 50 is issues with the prostate, okay? And prostate issues, where the prostate gets bigger and it can get inflamed, that can lead to increased going for a wee at night. So like we call it nocturnal urination, okay? Increased frequency, so you're getting up more frequency. Also hesitancy before you start to have a wee, rather than when you were a younger man, it would have just kind of, you know, been like a yeah, a lot stronger. It's a bit weaker. So there's all these kind of symptoms to do with the urinary function that can lead to more urinary tract infections in men, and prostatitis, inflammation of the prostate. And obviously, as your prostate gets bigger and more inflamed, there is the risk of higher risk of you developing prostate cancer. So if you're at the top 2 herbs, I would say nettle root, which is also known as Urtica, Diocca, Radix. So people might know nettle as the nettle leaf, you know, which, you know, it's got lots of iron benefits and it's a blood cleanser. Tastes a bit like spinach, but obviously it's got a bit of that, you know, tingly rash thing if you don't kind of cook it. So Urtica, Diocca, Radix, nettle root. Look, there was a study in the Journal of Herbal Pharmacopoeia in 2005, and they did like a randomized clinical trial where they used placebo. Yeah, so they get in one group of people, they give them nettle root, another group of people, they get placebo. And in 558 patients over 6 months, there was a modest decrease in the prostate size in the group using nettle root. Yeah, so there has been like strong clinical evidence about nettle root. And the other herb that is beneficial for prostate issues is saw palmetto, which is known as Serenoa repens. And a study in 2012 that kind of reviewed dietary supplements, it found that saw palmetto wasn't always beneficial for benign prostatic hyperplasia, which is where the prostate gets bigger, because it doesn't seem to impact prostate specific androgen levels. And again, sorry, I'm getting a bit technical, but that is a marker that men with prostate issues, they go to the doctor and the doctor will measure the PSA levels. Yeah, but saw palmetto combined with nettle root worked really well for nocturnal urination and urination frequency. Yeah, so in terms of saw palmetto for the actual prostate enlargement, it's not as beneficial as nettle root in terms of the amount of clinical evidence, but saw palmetto plus nettle root together worked very well for nocturnal voiding, so nighttime wheeze.
Okay, great information, Anita Chakraburtty. So let's kind of go over these herbs one by one and also talk about the benefits and maybe possible negative side effects, because someone listening to this might go, oh my gosh, that's me, rush out to the health food store and frequently overdo it. And men and women both can overdo it. So first of all, with nettle root, what are the benefits of nettle root?
Well, like I said, nettle root has benefits to prostate health, yeah, and the prostate gland. But look, you know, as I kind of say in any kind of radio show that I'm on, I'm not giving any clinical advice on these herbs. I am just talking about clinical trials where there's been some benefits, and it's for people to then kind of, well, I would say for people to come and see clinicians such as myself, you know, go and see naturopaths, go and see herbalists, go and see nutritionists, go and see trained people, because they can look at all the pharmaceutical medicine you're on and then work out herb drug interactions to know, I can give you that herb, but I can't give you that herb. You know, in the same way that, you know, you wouldn't watch a YouTube video on pulling teeth and do it yourself. So perhaps go to, you know, go to a health food shop and take, because, you know, herbs are like medicines, you know, that's why we're not allowed to just go to a shop and go, right, I'll have this heart medication, I'll have this prescribed by doctors. Yeah. However, you know, you have asked the question. So there's nothing specific apart from perhaps an allergy to nettles. You know, some people are allergic to nettles, therefore, you know, I wouldn't advise taking nettle root, but yeah, right. I would say really.
And in my 28 years in natural healing, nettles is a great herb for kidney health in general and for the urinary system. It's very nourishing for the urinary system.
Exactly,
and,
yeah.
And you know, what I find as a medical intuitive healer is people, they understand about, oh, I need to maybe detox my liver or my digestion's not working well. But most people are completely disconnected with their urinary system. Many people are functionally dehydrated, right? And another really simple, and this is not an herb, but a food healing approach is watermelon. Lycopene, which is a phytochemical that is found in watermelon and also tomatoes, but especially in watermelon, will nourish the kidneys and nourish the prostate. And if you do a watermelon cleanse by eating or drinking just watermelon juice, that will dissolve kidney stones and nourish the prostate. But back to you. Okay, so and we understand this interview is for educational purposes, and if you're listening, absolutely get help. And as a medical intuitive healer, part of what I do is go through a person's natural healing remedies, because sometimes people are taking too much or not the right amount, or they're taking something that maybe worked a while ago but not anymore. So let's talk about the benefit of Saul Palmetto and possibly any negative adverse consequences if you take too much.
Well, again, Saul Palmetto is seen as a male tonic. Yeah. So, if you've got, high levels of testosterone already, it probably wouldn't be very good for you to take too much Saul Palmetto. And again, anyone that has any kind of allergy to Serenoa repens or any of those species, you might have an allergic reaction to Saul Palmetto. But there isn't any kind of, obviously every herb there's toxicity effects, just like water. You drink too much water, you can die, but so there'll be like, the right levels to take of these and the right frequency to take. But, in terms of Saul Palmetto interacting with other drugs, it would only be for like prostate specific pharmaceuticals that you're getting from the doctor. If you're on any kind of medication for your prostate, there could potentially be Saul Palmetto interacting with that. So again, you'd have to be not taking Saul Palmetto, which is again why it's better to see naturopaths, herbalists, nutritionists, because they can do that kind of.
Are there any, Anita Chakraburtty, while we're on this subject, are there any medications that are absolutely contraindicated if a man is taking nettle root or soft palmetto? Like, you want to make sure that you don't take these herbs if you're on these specific drugs.
In terms of specific drugs, I can't recall the names, but if a man is on any type of prostate, because there are drugs, I know more the mechanism of, I can remember the mechanism of action better than the actual names, just because I've got a chemistry background. Yeah, I've got a master's in chemistry, so I kind of know all the, but anything that's like a 5-alpha reductase inhibitor, which is more complicated. I don't know why I can remember that, and I can't remember the name of the drug, but some men may be on that for their prostate. Yeah, so you've got to just be careful with any kind of prostate drugs, and nettle root and Saul Palmetto.
Right. And I would also say that as a medical intuitive healer and as the host of the Natural Healing Show, we want to use herbs in conjunction with other lifestyle factors. So as Anita Chakraburtty mentioned, if you have diabetes and insulin resistance, that's going to affect your hormones. And there's so many lifestyle factors that help men. For example, lifting weights will help you boost your testosterone naturally. Achieving a healthy body fat level. So if you're carrying too much body fat, that'll affect your hormone levels as well. And you want to look at diet. Drinking too much coffee, drinking too much caffeine will absolutely affect your urinary system, right? And drinking too much alcohol. There's something called aromatase. And when you drink a lot of beer, for example, a lot of men get breasts like women, because aromatase causes the body to convert testosterone into estrogen. So if you're a man and you seem to be developing breasts like a woman, then your body's probably producing too much aromatase, and you want to look at your alcohol consumption.
Especially beer, Catherine, because beer, humulus lupus, hops, you know, which you'll know, hops is in beer, and hops are estrogenic. So that's why the beer drinking men, rather than perhaps the men that are drinking rum or whiskey, it's more the beer drinkers that might get more fatty adipose tissue around the belly and the man boobs, because hops are estrogenic. And also to do with prostate health, as you're mentioning, lifestyle, that fat around the belly is physically impinging on the male reproductive organ. So it's kind of causing vascular issues as well as urinary issues. That area is getting physically compressed. So again, any kind of weight loss, if you have a big belly, would be beneficial for your prostate health.
Great information. And we're going to take a break and come right back as we receive a message from one of our commercial sponsors. So hang in there with us. Anita Chakraburtty, naturopath, professional astrologer, and shamanic healer. So we're talking about the top 10 men's herbs for men's health. And I get a lot of women coming to me because they're trying to conceive a child, and infertility is actually a huge issue in our society today for lots of reasons. And typically women are very focused on what can I do to improve my health. And often when we're talking about infertility, the men get overlooked. Is there any clinical evidence that herbs may help with sperm mobility quantity for men who are trying to help their partners conceive a baby?
I'm glad you've mentioned this, because I've been a naturopath for like 13 years, and I actually refuse to treat women on their own for fertility, because it takes two to tango, and there's no point having 50% of the party coming to the table. So I will always treat the men as well. So there was a clinical trial published in 2016 in the Journal of Evidence-Based Medicine, and they got 40 sperm specimens from 40 healthy men, and they divided it into 4 different groups. And one group got no treatment. One group got 20 micrograms per milliliter of a herb called Tribulus terrestris. Another group got 40 micrograms per milliliter of Tribulus, and the other group got 50 micrograms per milliliter of Tribulus terrestris. And it was the groups where they received 40 or 50 micrograms per milliliter of Tribulus terrestris extract that they had enhanced sperm motility. So motility is the movement of the sperm. They had an increase in the number of sperm, and they had an increase in the velocity of movement, so the actual speed that the sperm were moving. And they also found at the end of the trial that Tribulus terrestris boosted sperm viability, which is how much of the sperm is alive compared to how much is dead. So there's that 2016 clinical trial that showed that Tribulus does benefit, and you know, it can relate to the antioxidant content of Tribulus, because you know, it's an Ayurvedic herb. It has a tradition of kind of being used as an aphrodisiac. It modulates the immune system. It's a cardiotonic. You know, it's anti-inflammatory. So it's kind of a lot of benefits that could help the sperm. And there was another trial in 2019 in the Journal of Complementary Therapies in Medicine, where they did a systematic review, which is where all these boffins look at loads and loads and loads of clinical trials and get all of them, go, yes, this was a good trial. Oh no, this one had some errors. We're not happy with that. And they kind of narrowed down all these clinical trials, and they found 7 trials out of thousands that they looked at. And there were 7 clinical trials that showed Tribulus terrestris improved mainly number of sperm, motility, and morphology.
Great information. And I want to say that if I'm working with a couple on fertility issues, for the men, I'm going to ask them to increase the amount of zinc in their diet. You can get zinc from eating oysters and pumpkin seeds. right? Because those zinc also helps with your sperm health. And I'm going to get everyone to stop eating microwave food, which is a huge health problem in general, and just generally increase the amount of fresh food, fresh whole foods in their diet.
Yeah, brilliant.
Yes. Now, Anita Chakraburtty, we talked about possible challenges with saw palmetto and nettle root. Are there any adverse possible side effects of the tribulus herb?
Not that I know of, but again, you know, you might have an allergy to that herb, and sometimes you don't know until you take that herb. But there's nothing in terms of herb drug interactions that I know of with tribulus.
Right. I would also have a man consider maca root powder. And red maca is something that's going to boost your energy. It's good for your adrenal health, and it's good for boosting your sex drive in general.
But now, look, again, I just note a caution. You know, if a man is taking anything connected to their prostate from a, you know, prescribed by a doctor, then I would absolutely not take anything herbal unless a naturopath was involved in that prescription. Yeah, because naturopaths, herbalists, nutritionists know what they can and can't give. But if you're taking any kind of prostate health herb from your doctor, do not take tribulus.
Great advice. And again, we want to emphasize, if you're listening and you're curious about whether any of these herbs will help you, you absolutely want to consult a trained professional and make sure. I see people all the time where they're taking way too many natural healing remedies. I have people come to see me and I'm not making this up, they arrive with suitcases. and I'm like, well, no wonder you have a headache or no wonder you're, you know, exhausted all the time, because your herbs are not agreeing with you, and you're taking them with medications that don't agree with you. So we're going to just keep that in mind as we continue this wonderful information from Anita Chakraburtty. Now, many women are very focused on their thyroid function and how that affects their metabolism. Is it true that men's thyroid function may also be impacted by andropause, similar to menopausal women?
Yeah, so again, I see a lot of women who have been diagnosed with thyroid issues, and I've treated a lot of women, but men also get thyroid issues. And in the same way that during menopause, the drop in estrogen in women can lead to kind of hypothyroidism, which is where, you know, your TSH is getting disrupted and you've got more the kind of constipation and you've got the low libido and the fatigue and those kind of symptoms that can happen in men. I mean, you know, in terms of thyroid issues, women are 10 times more likely to have thyroid issues compared to men. But, you know, if you look at the incidence in 100,000 women, you get 370 women who've got thyroid issues. It's 73, 74 men per 100,000. So it's still a relevant amount. And I think it can just get overlooked by doctors, because I think you're a man, you're not going to have anything wrong with your thyroid. Look, in terms of some meta-analysis of, you know, 17 European studies, they found that undiagnosed hypothyroidism, so that's where your thyroid is struggling and it's not producing enough TSH, there was 6.4% in females and 3.4% in males. So it's about half, you know. So some figures are talking about 1 in 10 women, and then others, you know, showing that about half the amount of men get compared to women. So there's a significant kind of number of men that will have thyroid issues due to andropause. So
as a medical intuitive healer, all of my women clients over the age of 40, I'm going to absolutely look at their thyroid function, because one of the things that we know is that when you produce stress hormones, when you produce cortisol and adrenaline, the cortisol will absolutely lower your thyroid function. And there's an inverse relationship between your cortisol and your thyroid. So simply put, the more stressed you are, the lower your thyroid function, and the more stressed you are, the worse your metabolic rate will be. So part of what we need to do in general to heal our thyroid is to get our stress under control and to get out of that fight or flight pattern, which is, and the sympathetic dominance, which is so common. Anita Chakraburtty, you mentioned that the incidence of thyroid dysfunction and hypothyroid is so much worse in women than men. In your professional opinion, and again, this is just your opinion, why do you think that's the case?
This is just going to come from a completely shamanic spiritual perspective, but the throat contains the throat chakra. The throat chakra is about speaking your truth, speaking out. And speaking your truth could be, you know, I'm annoyed, I'm angry. And the throat chakra is also about creativity. And it may be that on a spiritual level, women are still in a position in populations where they feel they can't speak their truth, where they can't develop their creativity, where they may feel pigeonholed into a specific stereotype of living and working. And it may be that reason why the thyroid, which sits in the throat chakra, gets dysfunctional.
Great observation. And, you know, I have to completely agree with you there that the energetic, emotional, mental, spiritual aspect of thyroid is often overlooked. And I'll make this personal comment. So for many years, the only medication I took was for hypothyroidism. And when I was younger, I had taken a medication for many years that disrupted the thyroid. And I'm 63 now as of this recording, but in my 50s, I published 9 books. And in my early 50s, I stopped taking thyroid medicine and my thyroid's totally normal. So I agree with you. It was, you know, that creativity and that self-expression, which I think is sometimes harder for women to give themselves permission to speak their truth. So
and it does tend to happen. It is more, you know, middle-aged women where this happens, and perhaps on a spiritual level, the middle-aged woman is like, you know what, I've had my children, I've done my, you know, hard yakka, I'm in this job that I don't like, I kind of want to change my life, but I feel again impinged in some way of societal view of me, of, you know, my inability to speak my truth, that I now want to have this radical career change, radical lifestyle change. So yeah, it's funny how there is a big increase in thyroid dysfunction in middle-aged women.
Yeah, absolutely. So, but speaking your truth is really a big deal. So let's go back to talking about the top 10 herbs for men's health. What are the top herbs that you feel are helpful for men, for thyroid function dysfunction in men?
So I'm going to talk more about hypothyroidism, again, where you are more likely to have the symptoms where you feel the cold, or you have low libido, or you feel fatigued, or you feel constipated or depressed. And there's a herb called Fucus vesiculosus, which is a botanical name, but it's known as bladderwrack, and it's a seaweed. So, you know, on British beaches you'd see it, and it's got these big leaves, but it's got these like air vesicles, these little balls of air on it, so it's quite common for people to kind of pop them on the beach, you know. The whole plant would be used, and it's an anti-obesity plant. It's got anti-rheumatic properties, so you know there have been benefits in people with rheumatoid arthritis or arthritic joints, and it is a thyroid stimulant. So again, it would be more used in cases of hypothyroidism, not hyper, where your thyroid is like too stimulated. And again, in terms of, you know, herb drug interaction, if you're taking any multivitamins that contain iodine, you shouldn't really be taking seaweed because that contains iodine, and you don't want to give the thyroid too much iodine. And again, some people, you know, if you're pregnant, you shouldn't really be taking anything. But now we're talking about men's health. They're not going to be pregnant.
Yeah, not an issue here.
No. But again, you know, if men are on any kind of thyroid medication, they should not be taking any supplements for thyroid. Just kind of, you know, deal with your endocrinologist or deal with a registered naturopath, herbalist, nutritionist that knows that when you're on the pharmaceutical medications like levothyroxine, that you can have a certain amount of X or Y. Yeah. And the other herb is it's the root that is used here. It's a herb called Coleus forscoli, and it's an Indian, Sri Lankan, Nepalese herb that's been used for like 3,000 years in Ayurvedic medicine, and it's been mentioned in Sanskrit texts. It's not just beneficial to the thyroid, although it does benefit the thyroid. Again, it's a thyroid stimulant, but it's also a bronchodilator. It's a cardiotonic. It's good for high blood pressure, kind of heart disease and asthma and chronic obstructive pulmonary disease. You know, it's very good at kind of dilating the bronchioles where there's that kind of congestion. But again, you know, if I was using it for thyroid on a client thyroid health, it would be for hypo, so where there is suboptimal functioning of the thyroid. But look, that Coleus, again, I mean, I would not use if you're on any kind of anything like warfarin, because it's got cardiac benefits. If you're on any high blood pressure medication, don't use it. If you're on any peptic ulcer drugs, don't use it. You know, if you're on thyroid medication, don't use it. And again, yeah, really don't use any herb unless you see a naturopath or qualified people, really.
Great information. And from a dietary perspective, if I've got a client who's got a hypothyroid dysfunction, I would have them get the gluten grains out of their diet because that can affect their thyroid. Yeah. And I would get them on a gluten-free diet. And also I would make sure they're getting enough protein in their diet. Sometimes people are long-term vegetarians and that's affecting their thyroid function. And we also have to understand that all your hormones exist in balance. So if you've got a thyroid dysfunction, then and are hypothyroid, more than likely you've been in some degree of adrenal burnout for at least 5 years. So you want to look at what's going on with your adrenals.
Yeah, and they're also the correlation with thyroid hormone and estrogen, progesterone, and testosterone. You know, it's like it's all a very, it's complicated.
So you want to be thinking about how to get all your hormones in balance. Now, with that fabulous information from Anita Chakraburtty, let's take another break to listen to a commercial message from one of our sponsors. Hang in there, we're with us. We'll be right back. Anita Chakraburtty, naturopath, professional astrologer, and shamanic healer. As you know, one of the topics that men are very interested in is their libido. And if there's a topic that will make men really think about considering herbs, it's their libido. And one of the things that we know is that when men are happy, they produce testosterone. In that low libido in men may not just be connected to low testosterone. What are some other factors that affect a man's testosterone level, in addition to just the aging process where your testosterone's not going to be what it was when you were 18?
Well, obviously you've mentioned like libido and other things that relate to low libido rather than testosterone, and depression. You know, depression can be characterized by low mood, loss of pleasure, changes in appetite, changes in sleep, changes in energy, and low libido is a factor in depression. So when men have low libido and they're kind of thinking more about going to boost testosterone, they have to also think about serotonin, because you may boost testosterone and then you still might have low libido, in which case it could be serotonin related that your libido is low because you have depression that you may not appreciate. And a really good herb for depression that has got quite a lot of clinical trial information is saffron. And we all know about saffron being mainly in places, you know, grown in like Iran and Greece and India. But you may not know that in the 14th century in Britain, in Cambridgeshire and in Essex, it was a big producer of saffron. And people would go to Cambridge University and some of the lecturers would get payment in saffron strands. It was highly prized. And you know, still even then it was also very expensive because it has to be hand picked. You have to pick the stamens by hand. And even nowadays, you know, they haven't found a way to get a machine to delicately pick those stamens. But basically, yeah, British saffron production got decimated in the 1700s because the Puritans came in with the Civil War, and the Puritans were like, you're not going to have saffron, which looks like gold and it's very, you know, very glitzy. You're going to just have plain food. So no more saffron in your buns and your porridges. So that's why it kind of all disappeared in the UK. But anyway, yeah, there was a clinical trial published in 2006 in Phytomedicine. And it was a double-blind, placebo-controlled trial. And they got 40 men who had, you know, actually properly diagnosed depression. And they gave them 30 milligrams per day of saffron, one group, and another group just received placebo. And after 6 weeks, the group that received saffron, when they did look to their outcomes on the Hamilton Depression Rating Scale, which is just a statistical questionnaire, they ask you lots of questions, the people that had been taking saffron had better clinical outcomes from taking the saffron. So again, look, there is saffron, there is like, you know, this, you know, it's anti-inflammatory, it is kind of connected to like circulation and eye health, and so it does help, you know, it kind of has some impacts on the blood. So again, I would say if you're really on any kind of blood medication, if you're taking any kind of eye medication, if you have glaucoma, yeah, I'd be cautious in using saffron. And obviously I'm not recommending anyone goes to have saffron because, you know, it can interact with drugs, but there are benefits. And they compared saffron in other clinical trials. They looked at 11 clinical trials, you know, where they do this like meta-analysis where they look at thousands and thousands of trials and they get all of them, and oh, this one was good, oh, this one they didn't do it long enough, whatever. And of thousands of trials of saffron depression, they found that 11 clinical trials showed that saffron performed better than placebo, you know, so there's quite strong clinical evidence on saffron and depression.
Fabulous information. Now, Anita Chakraburtty, as you know, men are at risk of Alzheimer's disease similar to women. Is there any clinical evidence of an herb that has been shown to boost cognition?
So there's a herb called ginkgo biloba, which has been used in China from, like, evidence of it was in texts from 2800 BC. And there's 7 strong clinical studies where they compared ginkgo biloba with placebo in terms of cognition, and it was specifically people with Alzheimer's. And this 2021 meta-analysis, where again they're looking at thousands of different clinical trials with all the different studies, they narrowed it down to 7 strong studies with ginkgo biloba and Alzheimer's. So but again, you know, especially as you're aging, you tend to be on a lot of medication from the doctor. If you're on any blood thinners, you shouldn't take in ginkgo. If you're on anything to do with your heart, you shouldn't be taking ginkgo. If you're on anything to do with eye health, and again, that's where you have to kind of see a medical professional. Don't just go to a health food shop, get ginkgo and take it if you're on medication, because there will be very strong herb drug interaction with ginkgo.
And what about bacopa? Will you share with us about bacopa as well?
So yeah, bacopa is you'd use the whole plant. So ginkgo, it's more the leaves that are used, and in bacopa monnieri, it's the whole plant that's used. And there was a systematic review again where these boffin scientists, they're looking at thousands of different clinical trials, and they found 6 studies that showed when bacopa was used in healthy subjects, and not specifically Alzheimer, people with Alzheimer's, more healthy subjects, they saw a benefit over 12 weeks in 6 clinical trials, where people had definite improvements in their memory. So in terms of language, ideas, reasoning, they didn't really have very clear evidence about that. But Bacopa Monnieri, with regards to improving people's memory and recall, there was strong evidence in these clinical trials, six of them, that showed there was strong correlation.
Yes, and here at the Natural Healing Show for UK Health Radio, one of our recent guests has been Pete Hill, who runs a radio show about dementia. And one of the things that we talked about was if you have brain degeneration, it's so critical that you do some form of daily exercise, because when you exercise, even going for a simple walking, you release BDNF, brain-derived neurotropic factor. So you literally create new neurological connections when you exercise. And it doesn't have to be intense exercise. Again, weight training, going into the gym and lifting heavy weights is going to boost your testosterone. But just going for a simple walk and getting your circulation going is going to help your brain and help your memory. My first 10 years in natural healing was learning all about healing the brain. And when you do cross-lateral movements, such as walking, you're getting both sides of the brain working. And when you're stressed, one side of your brain shut down. So if you're right brain dominant, the left side is 75 to 85% shut down. And if you're left brain dominant, the right brain side shuts down. And so by walking, you're stimulating both sides of the brain, and you're boosting all of your neurotransmitters. So last two herbs that we're going to talk about, Anita Chakraburtty, great information. Men, as you know, are affected by stress as much as women. Are there any herbs that you recommend for men who are highly stressed?
So licorice is a herb that's been around for thousands of years, and the botanical name is Glycyrrhiza glabra, and it comes from the Greek word glycos, which means sweet, and rhiza, which means root. And in Chinese medicine, it was used for coughs, and they've found that licorice modulates GABA, and GABA is a kind of anxiety, stress kind of neurotransmitter. It's called GABA aminobutyric acid, and when it's in your brain, you kind of can't see the wood for the trees. You're just kind of.
So my comment about GABA is when your GABA levels are low, you're anxious. So you want to make sure you have enough GABA. So low GABA makes you anxious. And when we practice calming exercise like yoga or Tai Chi or Qigong, that also boosts your GABA. So licorice is good for your digestion as well, correct?
Yeah, exactly. And it's also a blood sugar regulator. And, you know, we've talked about cortisol and adrenaline in this show, and cortisol and adrenaline affect blood sugar, and that's why when you're stressed you kind of have blood sugar issues, which is why you're more likely to reach for a cream bun or a chocolate rather than an apple or an orange. So and that causes more problems when you're having sugar rather than protein-based foods. So yeah, but look, licorice is one of these herbs where just if you're you can't take it if you're on pretty much any medication, because it interacts with everything. So it's one of these amazing herbs that has so many benefits. However, it just interacts with everything. So you just can't take it if you're on any sort of pharmaceuticals, because it interacts with beta blockers for your heart. It, you know, interacts with, because it pardon me, interacts with potassium. So yeah, you can't take it from any diabetes medication. You shouldn't really take it if you're on any proton pump inhibitors for your, you know, stomach, because that will impact potassium and magnesium as well. So yeah, just if you're taking any kind of pharmaceuticals, you just can't go near licorice.
And final herb, let's talk about Tibetan rhodiola.
Oh yeah, rhodiola. The root, rhodiola root, is a wonderful herb. So there was a study in 2000 that looked at 56 healthy doctors, and they were given rhodiola over, I think, 3 different shifts. And they found that the doctors that had rhodiola, they had reduced fatigue during stressful situations, and they had improved mental alertness as well. So in stressful situations, there's clinical evidence that shows that rhodiola can help with stress and can also help with your alertness and your focus.
And your mood. It's often included in natural healing remedies and compounding remedies for depression, correct?
Yeah, correct. And there's also some GABA modulation that goes on with rhodiola as well as serotonin modulation. So yeah, it kind of works on neurotransmitters.
Great information. So Anita Chakraburtty, professional astrologer, shamanic healer, and naturopath. Any final thoughts for our audience about the top 10 herbs for men's health?
Well, I just wanted to squeeze in a little bit of heart disease stuff. I know we haven't got much time, but a very simple herb that's in most people's kitchens, if you like cooking, is garlic, which is Allium sativa. And there's lots of clinical trial evidence about garlic for atherosclerosis, which is basically the hardening of the arteries. It's also really good for reducing platelet aggregation. So people that are more likely to have strokes are where the platelets are all joining together and having a bit of fun, but that's not a fun thing because it leads to strokes. And it's also, contains a strong amount of antioxidants. So it also inhibits the enzymes that create lipids in the blood. So and it inhibits angiotensin converting enzyme, which is the enzyme that leads to high blood pressure. So garlic has got lots of clinical trial information on the benefits for heart disease. And hawthorn, which is known as Crataegus, in Phytomedicine, which is a journal in 2003, they had a look at people with congestive heart failure and they put them under kind of exercise stress. And they found that hawthorn was beneficial for people with congestive heart failure that were given some kind of exercise stress. So there's not tons of information on hawthorn, but the berry has got, a handful of trials that show its benefit in heart disease.
This is truly very helpful information. You've been listening to the Natural Healing Show for UK Health Radio. I'm your host, Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter so you can learn even more about how you can heal yourself naturally. Our guest today, talking about the top 10 herbs for men's health, has been Anita Chakraburtty, naturopath, professional astrologer, and shamanic healer. And you can find out more about Anita Chakraburtty and her wonderful work at multidimensionalhealing.co.uk. And remember, herbs are a basic part of natural healing. Thank you so much for listening, and we'll see you next time.